We studied the patients that visited the emergency room of a level 1 trauma center in the city of Philadelphia, one of 4 adult trauma centers, and looked at how the number of penetrating, uh, violent injury, and all injury cases presented to the trauma bay emergency room over the course of the beginning of 2020. We separated this into 2 cohorts before the Pennsylvania statewide stay-at-home order and afterwards. And what became evident, which is something we saw ourselves in the month of late March and April and even going into May, was that all emergency room admissions presentations dropped precipitously. So did the trauma admissions in general. And then looking at the penetrating injuries, which include stab wounds and gunshot wounds, they imperceptibly went down very briefly in late March and then started to rise steadily. And so looking at all cases, while the whole emergency department was looking more and more empty, the trauma bay was more and more filled with patients coming in with penetrating injuries of all sorts, mostly gun violence. And what we saw is those numbers were worsened by the pandemic, and they seem to follow a direct effect by the stay-at-home orders. Shortly after the late or mid-March stay-at-home orders, the Philadelphia COVID cases started to rise sharply, almost in mirror image to the decrease in trauma cases overall. And then when extracting the penetrating injuries, then those were not as sharp, but also increasing steadily during the same time. We then went on to compare those numbers before and after the stay-at-home order, which was March 16th, with years prior, all the way to 2016. And we found that while pre-stay-at-home order numbers were really the same, there were no statistically significant differences in penetrating proportion, in stab wound or violent injury proportion before the March 16th date. After the March 16th date, 2020 was truly different in that numbers went up by percent when comparing percent intentional injury, comparing percent gunshot wounds, almost by a 10 to 20% difference compared to all previous years after the March 16 date, which was the 2020 stay-at-home order. So why were people not showing up for day-to-day ailments? We know that the appendicitis rate and maybe the heart attack rate and the cold and pneumonia rate should not have changed by the fact that there was a stay-at-home order, should not have changed by the fact that there was an ongoing COVID-19 increase in the local population, yet those patients didn't present. And so since then, there's been a significant amount of data, none of which we looked at, published in JAMA and the New England Journal of Medicine and other sources that showed that the number, for example, of people dying at home with myocardial infarction or heart attacks had doubled or even tripled. And so clearly people are having the same diseases as before, but we're staying at home. And so the idea that police would bring in these patients into the hospital allowed us to say, well, then we don't know. How does that intersect with COVID? How does the shot patient carry or not carry COVID? So we had to prepare emergency decisions on how to put PPE on the providers, how to separate the patients among each other in the trauma bay. And at some point, this was as important to conditions where PPE was not readily available. So how were we going to protect the patients that were coming in shot and that needed urgent surgery, and how we were going to protect the providers? And the American College of Surgeons disaster plan helped in that. Although I have to say that the concurrent presence of both the pandemic and the, I guess, endemic trauma, penetrating trauma, did not get really defined or explained or guided by that plan or any other.